Welcome to Urology Unplugged. Today we are focusing on a common yet painful condition that affects many individuals, kidney stones. Joining us today is Dr. Abhinav Kumar. Dr. Abhinav Kumar is a highly skilled urologist with 17 years of experience and an MBBS and MS in general surgery from the Patna Medical College and Hospital (PMCH) and an MCH in urology. So, Dr. Saab, today we are to dig about some questions that every individual, at least most of the individuals, have to once in a life have to go through them. So, today let's start with the basics. So, what exactly are kidney stones?
Thank you for inviting me on this show. I am Dr. Abhinav, practicing at Savna Patna. I am a consultant urologist and transplant surgeon. Regarding kidney stones, as we all know, that kidney stones have become very common nowadays because of the lifestyle and the dietary factors which have affected our daily lives. Basically, what are kidneys? Kidneys are the filtering organs in our body which filters the blood and removes the waste materials, nitrogenous waste from the body. Sometimes because of the dietary factors or because of the less water intake, there are formation of stones in the kidney, which are nothing but some deposits of the calcium and mineral, which gets deposited in the kidney and causes different types of problems, and which needs proper attention.
What are the symptoms of a person who is feeling that he or she may be having a kidney stone?
There are many symptoms which commonly affects the patients of kidney stones. The most common being nowadays, if small stones are there, sometimes they can present, the patient presents with blood in urine, what we call in technical terms hematuria, or there may be severe pain if the stone gets stuck in the urinary pipe which comes from the kidney and drains the urine, which is called the ureter. And then it may present with severe colicky pain. It may be associated with some vomiting, nausea. If it gets infected, then it causes fever and different types of problems. It may also lead to damage to the kidneys, and there may be, if not untreated, if it is poorly managed, then it can cause severe infection, sepsis and all. There may be some stones are basically they are asymptomatic, or there may be some vague backache, but those stones are more dangerous because they grew with the time and they become very large and slowly damages the kidney. Because we are having two kidneys, so the patients are unaware of this condition and they may present late when the kidneys are already damaged. So anyway, if there is any sort of backache, or if patient is having blood in urine or some infection or anything like that, in those cases, it is advisable that the suffering patient should immediately consult their doctor and get themselves evaluated for the same, so that we can diagnose and diagnose the kidney stone, and we may properly at the right time intervene, and we can prevent the complications which are there
They are present
because of the stones.
So, Dr. Saab, this means that the symptoms could be both symptomatic and asymptomatic, just because of the presence of two kidneys. That one cannot get that whether it is just a body pain or that is due to a kidney stone.
Yeah.
Okay, so this I got to know that about the kidney stones. But what causes the formation of these kidney stones?
Yeah, this is a very important question because this is very relevant in this era. Because in this era, the food habits and all have been changed. Now the people are having more of fast food. The life has become very fast. So we should be aware of the conditions which causes formation of stone. The first and the foremost being the less water intake. If we consume less of water and beverages, then there are chances that our urine is more concentrated and these salts are precipitated, which leads to the formation of the stone. That is the main reason. The second main reason is the dietary concern. Because of the salt-rich diet and other factors which contributes like intake of more oxalate foods, non-vegetarian protein-rich foods, which leads to increased uric acid in the body, which may lead to the stone formation. This is the second factor. It is the more important factor nowadays, because nowadays we see like even children and adults, they are having more fast food, the more protein and less of carbohydrate and fibers are there, which leads to the formation of stones. They consume more of the packaged food, which is rich in salt and sodium, which leads to calcium excretion in urine and leads to the formation of stone. Similarly, nuts, which are rich in oxalates, and chocolates, these all are rich in oxalates, which causes stone formation. The third thing is the obesity, because as we can see that nowadays more of the Indian population, Western population are obese, and their BMI is high. So because of the obesity also there is a increased risk of stone formation. Third, the other things are like some inborn disease are there. The inborn disease of the digestive system, like inflammatory bowel disease, or some urinary conditions like renal tubular acidosis, or some like parathyroid hormone, if it is more, which is known as the hyperparathyroidism, which leads to increased calcium excretion and formation of the stones. So these are the factors which leads to the formation of different stones in the kidney. So nowadays we should all concentrate on our food habits, increase water intake and all, which may decreases the chances of the stone formation. Last but not the least, there are some family factors like there are family history of stones, which may lead to the formation of stones in their siblings, and if there are stone formation in the parents, there are chances like their sons
That
and
kid may
daughters
be
will
help.
have that stones.
Sir, just a question that there are many factors: lifestyle, food, the daily habits like eating fast foods and all. Just meanwhile, you told that that we are intaking oxalate food. What is this thing, oxalate food?
Oxalate rich foods, as I told you, like the foods rich in nuts, the tomatoes, spinach, these all foods contain more of oxalates.
Okay.
Similarly, nuts and chocolates, they all contain more of oxalates. So these foods lead to the formation of calcium oxalate stone. Similarly, there are some uric acid stones. If you consume more of a protein, there are more uric acid level increases in the body, which leads to the formation of uric acid stone. Similarly, if there are infections in the body, infection like females and the diabetic patients, they are more prone for infection, which leads to the formation of white stone. So there are different types of stone, and all are having some different.
Sir, do the kidney stones form in one kidney or both the kidneys, or at a time in both the kidneys simultaneously? What happens actually? How the things go?
See, there are different factors. They may form in one kidney, they may form in both the kidneys also. If there are some metabolic conditions like hyperparathyroidism, or if the dietary habits are not good, then there are chances of formation of stones in both the kidneys.
Okay.
But if there are some anatomical abnormalities in one kidney, which leads to some obstruction or some obstruction in the flow of urine in one kidney, like obstruction in ureter or some other medical condition like the ureter is not properly developed, then there are formation of stones in that kidney, and they are more prone for that. But it's not essential that its formation is limited to one kidney. It may form in both kidneys also, but generally we found like one kidney is generally involved.
So suppose someone has kidney stones in one of his kidneys or both the kidneys. So do all the kidney stones require surgical intervention or not?
No, all stones do not require surgical intervention. Small stones less than 4 to 5 mm in size, they can be very well managed conservatively by increasing the intake of the water and some dietary modifications like preventing the intake of diets rich in oxalates, proteins, and all. If there are infections, then they can control sugar level and they can have more fluid intake, which leads to the passage of these small stones through the urine. There are some drugs also available which we can prescribe, which leads to the passage and removal of stones from this kidney. But if there are more, the size of the stones are more, or if some stone is stuck in the ureter, which is causing pain, severe pain, infection, and vomiting, then it requires surgical intervention. But there is no need of any there is no need of any panic or fear for the surgery, because nowadays different types of advanced urological surgeries, endoscopic and lasers are available, and it can be removed easily, and the patient can go home in 1 or 2 days without having much risk.
Sir, more or less, we get to hear that you should drink more water or you should drink less water. So I have this question that how much fluid should a person consume in order to avoid or prevent the kidney stones?
See, optimum amount of water depends upon in which part of in which part you reside. Like if you reside in hot and humid climate, naturally there will be more requirement of water and beverages.
Like in India?
Normally, we can say like 2.5 to 3 liters of water is essential for body. But it depends if you are a more of a labor or some other class which works in more hot and humid climate, then it may require more amount of water. If you are in a more of a sitting job, more on, in the like less temperature, then it requires less amount of water. Similarly, those patients who are having some kidney issues or like their kidneys are weak, then we have to prescribe less amount of water. Or there are some heart condition or heart diseases also which requires less amount of water. But optimum amount is 2.5 to 3 liters at least we should consume, which comes to around 6 to 12 glasses of water per day. This includes all kinds of beverages.
Doctor, we have heard about a lot of myths regarding the kidney stone. Someone tells you should drink less, you should drink more water. And one of the basic myths that goes on that drinking less water helps to prevent kidney stones. Is that a correct one?
No, there are different myths which are running in society. But what you told, like drinking less water is not a solution. It's rather counterproductive. We should eat more water. But yes, those patients who are having some heart problem, as I said, or having some kidney failure problems, they are advised to drink less.
Okay.
But it's no way help you in kidney stone. Similarly, if there are some myths like if you consume some sort of pulses or some Ayurvedic or some different medicine, it helps in the passage of stone. These all are myths. The 3 to 4 stones, even if you don't take any medicine, if you take a lot of water, they will pass through your urinary tract. But if the stones are large, if they are stuck, then these medicines are not going to help. These some natural remedies will not help, and it will rather damage your kidneys, and it will lead to kidney failure of that kidney in future. So you must consult your urologist before taking any sort of medicine or whatever management you require. Similarly, there are some myths are there. It's more common in men, in women. There is nothing like that.
I was about to ask the same. That there is a myth that it happens more to men. Men are more prone to kidney problems or kidney stones basically. So is that
It's not directly true. But yes, those men who are working outside in hot humid climate, they are more prone.
okay?
But it doesn't mean like women are not prone to have the kidney stone.
Sir, I have one more question. Things revolve around the calcium intake. So there are people who say that are all kidney problems are caused due to high calcium intake?
No, it's totally wrong. Calcium, some stones are formed due to low calcium. If calcium is excreted more in urine, then some stones are more more incidence of more formation of that calcium stone. But in some stones like calcium oxalate, we should have a optimum amount of calcium intake. Otherwise, it leads to calcium oxalate stone formation. So it all depends upon whatever your metabolism is, but optimum amount of calcium you should keep to prevent the stone formation. Yeah, in case of some hyperparathyroidism patient in which more calcium is excreted in urine, they need to curtail the amount of calcium. But it's not so in all cases.
Okay, sir. The another question or another myth is once you have a kidney stone, you will have it forever for all your life, and the things never improve.
No, no, it's not like that. But yes, once you have a stone formation, there are chances of recurrence.
Okay.
There are more chances that you will suffer it and in future if you don't take proper amount of precautions in your food habits and water intake, and you are not evaluated for the stone by the urologist, which may find some metabolic abnormalities in your body, which may lead to stone formation in future also.
Okay, sir, as you discussed earlier, that oxalate foods cause kidney stones. So, do one should avoid all the kinds of oxalate foods available?
It's not so, but yes, if you are having a history of oxalate stone formation, then you must limit the intake of the oxalate rich food like spinach, tomato, nuts, and chocolates, etc., which are rich in oxalate.
Okay. Sir, for the last question I have that what lifestyle changes should one make to avoid all these kinds of problem and lead a good and healthy life?
Yeah, that is a very good question. That prevention is always better than cure, and we should follow a very healthy lifestyle, and we should must drink the optimum amount of water, like 3 to 4 liters, as I said. Similarly, we should adopt the healthy food habits. We should be rich in vegetable, fruits, beverages, and we should avoid the fast food. Increase protein intake, less sodium or whatever, less salt intake. These are the habits we should adopt. Similarly, we should have some exercise and yoga also, which helps to take our body fit. If the metabolism of our body is very fit, then there are chances of stone formation will be very less, and we will be healthy, and we should follow a good diet.
Okay. So, thank you, Dr. Kumar, for sharing your insights about the kidney stone formation. So, any final thoughts for our listeners who are listening to this urology podcast?
Yeah. It's I just want to thank through your program that you have invited me, and I have shared my insight. I just want to convey the information regarding to kidney stones to the viewers that we should have a very healthy lifestyle. We should drink plenty of fluids, water and beverages. We should follow a very healthy lifestyle, including our food and exercise. And if there are any like symptoms of kidney stone, like blood in urine, pain, if there is sudden pain associated with vomiting, nausea, if our urine is false smelling or some dirty, if any sort of urological problem is there, you must consult your urologist and to get yourself evaluated for the same, and you should spread the same message in the society so that we can treat kidney stones in the time and prevent its complication. Thank you.
Sir, thanks a lot for guiding our viewers for this, and you have been kind enough and so much patient to have a good conversation, and thanks for such an honest conversation. So friends, everyone, thanks for tuning into Urology Unplugged. We hope this episode has been informative and helpful in understanding the urological things that just the Dr. Saab has told us. So join us for the next episodes which will come, and we will explore more and more about the urological topics. Thank you.
Thank you.